Okay, a very good evening to one and all present here. I, Dr. Komal Lalwani, on the behalf of Nationwide Quality of Care Network, would like to welcome you all to today's UOP session. Today's session is on effect of stem cell therapy on quality of life of patients with neurodevelopmental disorder. The session is going to be taken by Dr. Nandini Gokulchandran. To invite the speaker for today's session, I would like to call upon Dr. Vikram Datta. Dr. Vikram Datta is the Director Professor at Department of Neonatology of Lady Hardinge Medical College, New Delhi. He is the President of Nationwide Quality of Care Network and Vice President of National Neonatology Forum, India. He is a guest editor at BMG Open Quality South Asia edition. He is a member of editorial board at International Journal for Quality in Healthcare Communication. He is expert at the International Society for Quality in Healthcare. He is a lead for National Mentoring Group and Technical Resource Group lead for Sustainable Models for Lakshya by Ministry of Health and Family Welfare, India. He is a member of QED, that is Quality, Equity and Dignity Working Group by Ministry of Health and Family Welfare, India. I would like to call upon sir and request you to please introduce the speaker of today's session.
Good evening, Dr. Komal, and a very warm welcome to Dr. Nandini Gokulchandran. And what a privilege to have you on board this Communities of Practice session. And in fact, I believe that this is a very niche area where you are working, and probably the only expert in the field in the whole country who's done extensive work in the areas of stem cell therapy. I'm sure a lot of people would be still unaware of the areas and its implication into the future. And I believe that this is the innovators group of NQCN which has joined this session today. So I would just be briefly giving the introduction to Dr. Nandini, though the CV of Dr. Nandini is quite extensive. But to start with, Dr. Nandini is the Deputy Director and Consultant at Regenerative Medicine at Neurogen Brain and Spine Institute, Navi Mumbai. She has over 20 years of experience in regenerative medicine, and she is the Editor-in-Chief of the Indian Journal of Stem Cell Therapy, quite an accomplishment, I would say, and has published over 104 articles in national and international peer-reviewed journals, and has co-authored 18 books on neurological disorders. She is also the chairperson of the Institutional Committee of Stem Cell Research at Datta Meghe University, Savangi in Maharashtra, and member of the Institutional Ethical Committee, StemAid Biotech, and also the member of the Institutional Committee as a stem cell expert at LifeCell India Private Limited with the umbilical cord blood cell division. So I take this opportunity to welcome Dr. Nandini Gokulchandran once again to these Communities of Practice. As Dr. Nandini, you are aware, this is Communities of Practice which caters exclusively to the healthcare workers, regardless of their domains, cross-cutting across various clinical specialities, and right from our nursing fraternity, very strong presence, well into the tertiary, primary, and the secondary levels of care. So what do you, Dr. Nandini, for the presentation? And we would just learn and try to take home the key takeaway messages and see how we can apply it for the betterment of life of children suffering from neurodegenerative disorders. What do you, ma'am?
Thank you so much, Dr. Vikram Datta and the team of NQCN. Really a privilege and honor to be invited to this forum. I know Dr. Vikram Datta since maybe I was a child, and known as a very gentle pediatrician, and the commendable work being done by your network, sir, and that I will be able to contribute at least 1% maybe to the knowledge of this forum. I'm really happy and honored. So to start with the presentation without much ado, I would like to share the presentation. So the topic of stem cells, or some people known as regenerative medicine, or now also being referred to as cellular therapy, is a very sometimes misunderstood field, has so much potential. It has, if we get the insight to what all changes it can bring into our lives, we would be amazed. But of course, it is rife with a lot of controversies and certain dogmas which are not changing, unfortunately, in the field of medicine. So I have two challenges here, and one is to make you all aware and understand the basics of the stem cells, and also to see how it can be applied to neurological conditions. And so neurological conditions, as we all know, are in fact one of the toughest and most difficult disorders to handle in the field of medicine. And in fact, I would say most of us have given up on treating neurological conditions. There are a handful of neurological conditions which get treated definitively, because for a long time we have had this understanding that once damaged, the nervous system cannot be regenerated. And that's where I would like to put forth evidence which we have collected over the last 13-14 years of our practice, that it is possible to improve the quality of life of patients with neurological conditions. Though there are multiple neurological conditions that we deal with, I'm focusing here on neurodevelopmental conditions to start with, because it's difficult to cover so many in a short span of time. So I am going to focus on three disorders and why. So autism spectrum disorder, cerebral palsy, and intellectual disability. Now, autism spectrum disorder, because just look at the incidence. The global incidence is 1 in 100, and if you look at the prevalence, it is now 1 in 40. So the prevalence has increased logarithmically, like almost like a pandemic. So I don't think it is any less than a COVID pandemic. COVID pandemic was there for a short time, and autism pandemic is here to stay and going to change lives of so many families, and it is affecting more and more children now. So we need to understand what happens in these children, and how can we help them mainstream and become part of the community. That is one. Then of course cerebral palsy, and since most of you are workers at the primary level of healthcare, we know how rampant cerebral palsy is because of so many factors, factors of a mother being anemic and not ready for pregnancy, post-delivery, post-delivery care. So nearly one to nearly 4 per 1,000 live births. That is a huge number, right? At least for India and of course the developing nations around. Intellectual disability, again 10.5 cases per 1,000. So this is just to show the problem that we are dealing with, and that's why is it important to find definitive or interim solutions to help improve the function of these individuals. So what are the current paradigms? So what are the current paradigms here now? Number one, in the treatment of these conditions, one is, we know there is no cure, and that is what every patient or every family is told, that you have to live with this condition. There are no surgical interventions really in these conditions where we can do any surgery on the brain and improve or remove a tumor, or maybe do a BP shunt. But in the case of autism or cerebral palsy or even intellectual disability, nothing like no surgical intervention that you can do really on the brain. Only what we have is rehabilitation. So neurorehabilitation is the pillar around which the treatment occurs, and no medicines really to completely treat, but yes, medicines to treat the symptoms. Seizure medications or anti-epileptics to reduce the possibility of seizures, anti-spasticity medications in cerebral palsy. So these are only symptomatic treatments. So this is the current paradigm. So what is new that we have apart from these? What we have is, as I said, cell therapy, we call it cellular therapy, we can call it stem cell therapy, we can call it regenerative medicine. So that is one part, apart from rehabilitation. And I'm going to introduce one more new concept, depending on the time that we have, is integrative therapies. That is the addition of oxygen-based therapies for these conditions. So how the combination works, we believe it's a teamwork, that not one thing, there is no one Ramban upaya, as we say, there is not one thing which is going to hit the target. It is going to be a combination of medical treatment, rehabilitation, integrative therapies, and two more things which I'm not going to talk here about is the academics or the school support in these children, as well as the community involvement. And that is a completely total different topic, which I'm not going to handle here. So what is the old thinking? The old thinking is that central nervous system, once degenerated or once injured is incapable of regeneration. However, it's been almost 20 years since this dogma has been proven to be wrong. We know that there are niches in the brain which continue to multiply till we die. How else do we form new memories? Because the cells in the part of our brain known as hippocampus continues to multiply and connect. That's why we create new memories every day. So it is possible to regenerate the brain to some extent. Definitely may not be as much as skin or as much as a liver, but certainly there is some plasticity, there is some capacity of regeneration which can be assisted by cellular replacement and repair. Hence, stem cell therapy is not a fiction. It is not futuristic medicine. It is an idea whose time has come here to help individuals who are not walking to walk, those who are at home doing nothing, to help them become more functional. Now, to understand the concept of stem cell therapy, we first need to go back to before stem cell therapy. What were the treatments available? What was, if somebody has a particular ailment, we either had medicines or medicine-based products, or we had a surgical procedure. So these were the two main things, right? Now, the concept of cell therapy, it's neither a medicine nor it is a surgical procedure. So that's why cellular therapy becomes a different branch or a different area altogether to explore, to understand, and hence the yardsticks or the paradigms in which we either weigh medicines in terms of finding whether it is effective, or a surgical procedure. Both yardsticks cannot apply to cellular therapy, and hence we have to relook at it in a different way. Now, the concept of brain. So I spoke a little bit about stem cell. I'm going to come back to it, but I'm now also interceding a little bit about the brain. Now, when we look at the brain, we feel that, okay, it cannot be regenerated, and that's why only rehabilitation therapy, physiotherapy, occupational therapy is important. However, when we think of a fracture of the leg, what happens if you fracture your femur or your tibia? What do? Do we start walking immediately? Do we start doing exercise therapy immediately? No, we need to heal it. We need to stabilize this fracture and then do the exercise and therapy. Why not for the brain? Similarly, for the brain, we believe at Neurogen that it's important to heal the brain from inside, and then when you do the rehabilitation, then when you do the therapy, that therapy becomes more effective. So here you can see a scan of the brain where we are using PET-CT scan here as the baseline for understanding the metabolism in the brain, and you see the blue areas here functioning less. And this is a scan after the stem cell procedure, about 6 months after. You see that the brain functioning is improved. So when we heal the brain from inside, it is more easier to train the patient and get better results. So that's the introduction of the stem cell in the brain. So what is the scientific basis of stem cell therapy? Is it something which is, very recent? No. In fact, you would be surprised to know that there are 3 or 4 Nobel laureates in the field of stem cell research in the history of Nobel Prize. So the first Nobel Prize was awarded to stem cell research for the understanding or demonstration of stem cells in the bone marrow way back in 1990 to Professor Thomas. So we all know that if somebody gets a Nobel Prize, their work is preceded by almost 20-25 years before the Nobel Prize is awarded to them. So you can well imagine that this work must have started sometimes in the late 70s or 80s at least, if not before that. Then in 2007, Sir Martin Evans was awarded the Nobel Prize for the isolation of embryonic stem cell in the mice. And then more recently in 2012 for the concept of induced pluripotent stem cells to Professor Gurdon and Shinya Yamanaka. Now, these, I know it's very maybe difficult to understand, but these are progressive different sources of stem cell. Bone marrow, all of us knows. Embryonic, from the embryos, which I will be talking a little bit, and about induced pluripotent stem cells. I will be talking a little bit about each of these stem cells in a few of my next slides. So just imagine or think about, I'm not aware, maybe I'm wrong, but in any field of whether it's medicine, whether it's physics, whether it's economics, whether it's literature, have there been so many Nobel Prizes awarded to any one field? So I don't think so, at least not in medicine, right? So how much would stem cells have evolved to be able to have got 3 Nobel Prizes in the span of, say, 20 years? So that's a lot of progress. And then also I'm told that, oh, it's not there in our in our textbooks. Not really. Way back, I think in the 15th edition of the Harrison's textbook of medicine, which all of us read, the chapter on regenerative medicine was introduced. And where, in fact, if you look at it, in the introduction, it does say that there's a possibility of stem cells being used for Alzheimer's, for multiple sclerosis, for traumatic brain injury, for Parkinson's. So there is an introduction of possibility of stem cells used in neurological disorders. So that is just to give you a background that it is not really unheard of. It's not that no research has been done. A lot of research and a lot of evolution, just we have not been able to keep abreast of the amount of evidence that is coming in. At Neurogen, which I represent, I've been associated with Neurogen Brain and Spine Institute, and the name itself, there is Neurogen, neuro regeneration, and that's where we come in. We believe in the possibility of the brain and the spine to regenerate. So what is the scientific basis? We believe a lot in research, and because of that, almost 106, 107 publications on various neurological disorders that we deal with in the last 14 years. So almost more than 100. So autism 16, cerebral palsy 15, intellectual disability 4, muscular dystrophy 18, spinal cord injury 9, brain stroke 6, and others such as an amyotrophic lateral sclerosis 11, then spinal muscular atrophy a few, then head injuries. So there are a whole lot of other disorders where we have worked on and put together the information data for public consumption. Apart from that, we also believe in information transfer through simple means, through books and not only publications. So books for doctors, books for professionals, as well as books for caretakers on various disorders like autism, handbook for autism, for muscular dystrophy. This is to be able to reach out to a lot of parents, professionals, and be able to disseminate the information what Neurogen has done and what is available through the world. And I just wish people would come out and read this. In fact, we distribute it free of cost for information and knowledge sharing. Apart from that, credibility of the work that is happening anywhere, as well as what we do, not only from the publications, but also, as Dr. Vikram Datta mentioned, leadership in the field. So we are invited to write book chapters. So we have written book chapters in international textbooks on one is on recent advances in autism. In a book known as Cerebral Palsy Challenges for the Future, we've written a chapter on stem cell therapy for cerebral palsy, a chapter on physical disability, book muscular dystrophy. This is just to give you an idea. So when we look or do a PubMed search, so let us see how much work is happening in stem cells. This is just to give you an overview, an idea, to excite you that what is happening in the field of stem cell research and treatment. So when we look at stem cell, when we search stem cells, we get almost 3,34,476 search results. Okay. Then when we look at stem cell transplantation, we get almost 1,22,491 search results. So that's not less, right? And then we look at stem cell transplantation in neurological disorders. So yes, it is limited to 11,925, so not less, right? So there is a lot of information and evidence coming in. And however, we did see that there's a lot of research happening, but what is happening in terms of translation to the patient? Yeah, finally, as medicos, we want treatment to be available to the patients, right? So I did my MBBS and I did my MD in medical microbiology. Then I did research in Tata Institute of Fundamental Research, where it is fundamental basic research on stem cells, on brain development in mice. But finally, I wanted to be able to apply this for patients, right? From bench to bedside, it's a long journey. So I would like to just quote the famous chemistry Nobel Prize winner 2004, Aaron Schiznauer, that in the basic science versus clinical medicine, there is a problem of time scale. In science, unraveling secrets takes a lot of time, but meanwhile, patients are suffering and even dying. Therefore, we need to find intermediate solutions for the problem. So it is important to be able to bring forth simple, easy, safe solutions so that individuals can, improve. So that's where we believe that stem cells, when used in a simple and safe way, become very effective. So now, what are stem cells? So much I've spoken about regenerative stem cells, Nobel Prize, blah, blah. But what are stem cells? Okay, are these medicines? Do you go to a shop to buy them? No. So stem cells are like stem of a tree, right? Stem of a tree gives rise to branches and leaves and flowers and fruit if proper water and fertilizer is given. Similarly, there are cells in our body which are special cells. They are not specialized cells, they are special cells, they are immature cells, and they can become any type of cell that you want them to become based on where you put them, right? So how do they work? Okay, they work by a few different mechanisms. One of the most common mechanism is multiplication and paracrine effect. So one cell, these cells have the potential, one cell can become two. Can you see two similar to them? And then again, they can multiply till you give them a environment to become different type of cell to differentiate. So it's like, I give an example, like when a child goes to school, this child has so much potential, right? We don't know whether this child will become a doctor or an engineer or a physiotherapist or artist. So what are the factors that would make this child what he will finally become as an adult? So there would be school environment, there would be home environment, and his own potential. So similarly, these cells have their own potential, but depending on what environment or ambience you give them, they will differentiate or become that type of cell. So if you put them in the liver, they can stimulate the hepatocytes in the liver and eventually become hepatocytes as well. If you put them in so in fact, these cells are used for maladaptation or malunion of the bones. They can help the bone heal. Stem cells are used to also heal skin wounds, which are non-healing ulcers and wounds. So similarly, we are using them for the brain to help improve the brain functioning. They release growth factors. This is known as the paracrine effect. So they release growth factors which will help the local cells to proliferate, to prevent cell death, or known as apoptosis, help improve blood supply, help to connect or network, as well as release antioxidants, which will again prevent cell death. So it is all about stimulating the cells to reach their maximum potential. There is another mechanism which is found especially in bone marrow derived cells, is the release of exosomes. These are microRNAs containing vesicles, which help in reducing inflammation, which helps in neurogenesis, formation of new blood vessels, again, neurite remodeling, as well as improving the neurological function. So this is another method apart from growth factors, which has been found in the bone marrow derived cells. And as I said, new angiogenesis, formation of new blood vessels and release of oxygen, as well as growth factors. So these are different ways that stem cells would work. Now, there are different types of stem cells and they can be classified using different ways or based on different ways. One is based on their potency. How potent are they? Number two, based on whether they can be transplanted to the same person or whether it needs to be given to somebody else, and depending on how much we have manipulated them. Are they just simply separated and injected, or are they multiplied, or is there a tampering, or is there a mutation change, or we are stimulating them to become something else outside and then putting in the body? And depending on where you source it from, where are you getting it from? So these are different ways that you can classify the stem cells. So based on the potency, So it can be totipotent. Totipotent means like when we were in the mother's womb, the cells or the bunch of cells were totipotent. Totipotent means they can form each and every different type of tissue, different type of cells, as well as the placenta. So the connection as well. So that is the totipotent cell. Then there is a pluripotent cell. Pluripotent cell can form all three different germ layers. We are all, born from three germ layers, right? Ectoderm, mesoderm, and endoderm. So pluripotent cell is capable of forming cell of any of these origin, but will not be able to form the placenta. Okay. The third is the multipotent. Multipotent have limited differentiation potential, maybe closely related families, and then unipotent, where they can form only one type of cell. So this is based on the potency. Then based on the transplantation, stem cell can be transplanted autologous when we take from our own body and put it back into our body, and allogenic when it is taken from somebody else and then transplanted. You are aware of allogenic transplantation. Bone marrow transplantation for blood disorders or hematopoietic disorder is one of the most common example of allogenic transplantation. Then based on manipulation, how much are you really handling the cells? So minimal manipulation or more than minimal manipulation. So minimal manipulation means you take bone marrow, you separate out a fraction of cells, you inject back. So there is no multiplication, there is no freezing, there is no thawing, and so you are not changing the character of the cells. This is known as minimal manipulation. You're just cleaning the unwanted cells and taking the wanted cells. Then more than minimal manipulation is, okay, you take the bone marrow, you separate a certain fraction of cells, then you culture them in the laboratory, you multiply one type of cell, and then you use them after multiplication. This is known as more than minimally manipulated. The other way of classification is from the source. So as I said, the earliest source is the embryo. So there are a lot of couples who go to for in vitro fertilization, right? Test tube babies. So there about 10 to 12 embryos are fertilized outside, and then 3 to 4 of the embryos are put in the mother's womb. About 7-8 go waste. From those 7-8, when cells are cultured in the laboratory, you get a bunch of cells known as embryonic stem cells. These embryonic stem cells have a lot of research potential. However, there are a few issues with it. In fact, they are totipotent. They can form any type of cell of our body as well as the placenta. However, they have the inherent capacity to form teratomas, because if they do not form teratomas, they cannot be labeled as embryonic stem cells. So embryonic stem cells will form teratomas if you leave them alone. That means in that bunch of cell, really it's amazing when you see it cultured. You just leave them with growth factors and you see some hair cell growing, you see some teeth, you see some cells pulsating like heart. It's an amazing sight. However, because of this possibility of teratomas or tumorigenicity, they have unfortunately got a very bad name. Apart from that, there are certain religious issues, ethical issues, like you are killing an embryo or you are taking embryo which has life. So then again, a lot of human rights issue. Hence, for treatment purposes, for transplantation, embryonic stem cells are not a good option. However, they are very good tools for research. In fact, increasingly, they are being used instead of animals. Embryonic stem cells are being used to test out drugs, the toxicity of drugs, the safety of drugs. So they are a very good research tool. Then, of course, all of you must have definitely heard of the cord blood stem cells. Cord blood stem cells, again, is a very good source of stem cell. It is a day zero stem cell for that child. If there is, I believe it's like a life insurance policy. If there is a family history of blood disorders or of any other genetic condition, then in a sibling, it is worth storing it. A lot of work is still happening on cord blood, and we hope that in the future it will be a good source to be used more often. At this point, there is limited usage, but wherever it can be used, it's a good possibility, especially for, I would say, for public cord blood banking would be a good thing to have, in fact. Now, if we don't have cord blood, then we cannot use embryonic stem cells. What source do we have? We do have the adult stem cells. You and me, we have a lot of potential in us, and we sometimes forget that. So we have in our own body a lot of cells which still continue to multiply lifelong, like bone marrow, adipose tissue. In fact, increasingly dental pulp cells are being studied. So at least these three sources are very good source possibilities of stem cells, though they have limited potential, but they are very, very safe. In fact, bone marrow stem cells are the most studied and most safest of all the types of stem cell for clinical treatment, I believe, especially for neurological conditions. So adult stem cells, they don't have ethical concerns. We are not killing an embryo. They will not multiply lifelong. They will never form tumors. So adult stem cells is a very good source of stem cells for treatment, for clinical transplantation. And the fourth, the induced pluripotent stem cells, which I talked to you about, that in 2012, two professors or two scientists received the Nobel Prize for this particular understanding. Now, what does this mean? It's a very exciting possibility, but though still being understood how it can be used for treatment. It is use of adult cells, convert them into embryonic. So we are not killing an embryo. So we have a skin cell, and the skin cell is the age of that person. So if I am whatever age, my skin cell will be of that age, right? So you can challenge the DNA, you can tweak the DNA and convert the adult skin into an embryonic-like cell. So this would be like a customized stem cells or a designer stem cell. But a lot of work is happening to see whether we can treat retinitis pigmentosa or retinal degeneration using induced pluripotent stem cells. So once you have embryonic-like stem cell of a person, that can be then differentiated into retinal cells, into platelets, into RBCs. And in fact, in India, Prime Minister Modi has started a collaboration in Bangalore in STEM to see whether this particular technology can be used to treat sickle cell anemia. So very, very exciting things happening currently in India. So these are the four different sources, and I hope you have understood a little bit more detailing. As I said, embryonic advantages, they can differentiate, but tumorigenicity and ethical concerns. Cord blood, it is possible, no risk to the mother. However, storage is an issue. Limited dosage. In adult, it's difficult to use. One cord blood will not be enough for blood disorders. Advantages of adults is it's safe, it is effective, but there is a restricted potential. That's the disadvantage. And induced pluripotent stem cells, a lot of potential, lot of excitement, but still to be studied for genomic instability. When you manipulate the cells to become embryonic stem cell, you're changing the characters, so there should not be any unwanted character introduced during that process. So this we are still, evaluating. So, so this is Professor Stephen Williams. He unfortunately is no longer. He was a very renowned physicist, a Nobel laureate who got Nobel Prize for the discovery of the black hole. He suffered from motor neuron disease, a degenerative neurological condition, also known as amyotrophic lateral sclerosis. Unfortunately, he passed away a few years back, but when he was alive, he was a big supporter of stem cells. And if you heard him speak that our body has so much regenerative capability, unfortunately, we were not able to reach him and able to save him. However, this is what we believe, that we don't need to look for sources outside. We can use our own body's regenerative potential to treat our own neurological condition. So that's where we are. That's what we do at Neurogen Brain and Spine Institute. We use our body's own stem cells, our own bone marrow, mononuclear cells separated and injected into the spinal fluid. So that's the procedure of the treatment. So let us look at this video, which shows how the transplantation. This is the bone marrow being aspirated from the anterior superior iliac spine, processed in the laboratory. Very simple processing, no chemical mixing. It's a gradient method of separation where we separate, we look at the viability of the cells, we find the cells and we inject them into the spinal fluid using a very thin needle. So no cut, no stitches, very simple, very safe and very effective method. So we treat a whole lot of neurological conditions. However, I'll be speaking on a few of them. So what are we doing? Intrathecal transplantation of autologous. So our own. So if I have a brain condition, I have cortical atrophy, I would take my own bone marrow and we would take the patient's own bone marrow, separate the mononuclear cell fraction. So it is not one cell, and I will be a little bit elaborating on that. And then injecting. What is the rationale? When we will see why intrathecal. So why bone marrow? It is safe. Okay, simple procedure, right? Non-tumorogenic. So far in literature, it has not been shown that these cells form tumors. No rejection issues. We are using our own cells. No immunosuppression required. Easily obtainable. No ethical issues in terms of killing an embryo. We are not, killing an embryo. These are our own punji, right? So, what does bone marrow mononuclear cell contain? It contains a mixture of cells. It contains hematopoietic stem cells predominantly, some mesenchymal stromal stem cells, endothelial progenitor cells, and very small embryonic-like stem cells. So it is a mixture, and we believe and we feel and we have found that a cocktail of cells, each having different action, whatever they're doing in the bone marrow, we are basically, using that activity in the brain or maybe in the liver or in the heart. We are doing it for the brain, so I'm going to talk about the brain. And injected into the spinal fluid. Again, minimally invasive, no cut, no stitches, safe, no major side effects if done very carefully. Lumbar puncture is one of the safest processes. And when we inject the cells into the spinal fluid, there are studies which have shown that these cells go home on to the site of inflammation and injury. And the best part is that unlike intravenous injection, here when we are giving the cells into the spinal fluid, these cells can reach the nervous system directly. So many people, for safety reason, want to inject intravenously. However, we know that cells injected intravenously, since these are cells, they will get trapped into the lungs. 70% of the cells get trapped in the lungs. So it is a very good way for COVID. In fact, COVID, we have done intravenous injections. We have done a study on intravenous injection of stem cells in COVID. But for brain, we believe that we need to reach as near the brain as possible. So the other way would be a stereotactic injection into the brain, which unfortunately increases the risk in individuals, patients, and children. So we find that when we are weighing the risk versus benefit, the risk of intrathecal administration is minimal and benefit is much higher. So why, as I said, intrathecally, when we inject, there are studies which have shown that when you track them with magnetically labeled cells are injected into the spinal cord, they reach the site of injury in the spinal cord. Now, as I said, it is a combination, it is a teamwork. Okay, cells are injected into the spinal fluid, and these are stem cells. So stem cells, just like stem of a tree or like seeds that we put in the plant that comes out the stem, will need support, and the support is like growth factors. We will need therapy. So we believe a combination, a teamwork is very important. A stem cell therapy in combination with neurorehabilitation is the process we started about 13-14 years back. So when we do this combination, we find beautiful results. So neuroregeneration combined with neurorehabilitation is a very beautiful complementary process and helps individuals or children with neurological conditions. So we have a combination. So we have all different therapy: physiotherapists, occupational therapists, speech therapists, psychologists, aquatic therapy. We have nutritionists, we have neurosurgeon, we have a neurologist, we have pediatrician. So everything. We do sexual rehabilitation, we do urological rehabilitation. meditation. So everything together helps children improve. So we have a pediatric physiotherapy setup, we have an adult physiotherapy setup, and we believe in one-to-one healing. You will see not many machines in our setup. So it is a hands-on healing by the therapist to the patient. That is very important. Occupational therapy, a very important part. So this is our USP combination. Whatever works best for the patient. It's not about stem cell working or rehab. It has to be a combination because they help each other, they complement each other. In fact, there are studies which have shown that exercise mobilizes stem cells in the brain. So when we do exercise, the inherent stem cells also get mobilized, plus the stem cells that we have injected mobilize better. So ABA, or psychology, cognitive rehabilitation, sensory integration therapy, speech therapy, aquatic therapy. Also, therapy in water. That is again a new thing that we have introduced. So let's look at what are the results. So the proof of the pudding is in its taste and its eating, right? So let's start with autism. So stem cell therapy for autism. Even before understanding the results, I would like to throw a little bit light on our study on the brain functioning. So autism, we know that when we look at the MRI of the brain broadly, the MRI seems to be normal. Everything broadly seems to be in its place. There are a few studies which says the hippocampus size is different, or now in fact we are looking much more deeply in MRI, which has not been published, that the corpus callosum, the connections are somewhere weak. However, even before we could understand this, we looked at, okay, broadly the structure is fine. So let's look at the functioning of the brain, right? So we looked at the functioning using the positron emission tomography, which is usually used for studying the cancers, but here we are using it as NeuroPET. So NeuroPET was developed and understood by us, very extensively being used. There were a few studies where they used PET to look at the blood flow in the brain. And so only a couple of studies were there. And when we looked at the baseline in autism, and this was published in the World Journal of Nuclear Medicine. And interestingly, this is what we found. And we find this consistently in all patients. So when we look at the brain functioning using PET scan, you can see, and you will be seeing this these kind of images very frequently in my presentation. So I'm going to take like a minute to give you an understanding of how to interpret this. So when you see the brain, this is the side view of the brain. Okay, so this is the front of the brain, the top of the brain, the back and below. So the major cortex, the major part of the brain is all fine. Okay, the green, the yellow, the red is all functioning well. However, the blue areas that you see, these are functioning less. And when you look at the blue area and we look at the function, those who understand or have some understanding of autism will say, Eureka, okay, I understood it finally. Okay, so hippocampus, okay, the hippocampus and amygdala, this is known as the mesial temporal region of the brain, which is responsible for understanding, cognition, comprehension, socialization, and emotional expression. Isn't this what is the problem with children with autism? Then the cerebellum is like a traffic police of the brain. So there is a lot of information coming into the brain. However, processing and output is a problem. So fine motor activity, coordination, balance, oromotor, articulation, and sensory processing. These are defective in children with autism. And of course, between the two brain, we have the thalamus, which is a relay center. Again, thalamus is functioning less. So the functioning is less, not the morphology. And this is what we found. One more very interesting thing that we found in our study was that when you look at the brain metabolism over a period of years, if you look at this graph, the blue indicates the cortical metabolism in the brain over 15 years. So in a neurotypical, this is blue indicates neurotypical or typically developing children. We no longer use normal because who is to say you are normal or I am normal? So neurotypical or typically developing children, the brain functioning in metabolism increases very rapidly over 10 years. After 10 years, it does increase, however, slightly slower down. In case of children with autism, the cortical metabolism, in fact, early on is very high, but with time keeps on going down. So that's a very interesting observation that we had, and that's why we believe, and which is known as that early intervention is very important, right? Earlier you do treatment, more possibility that you can push the child, or push this graph up. That's why we believe that before 5 years, if we intervene, if we do the treatment, we are able to get children to a good functional capacity. Now, as I said, autism, why do we need to find a solution or find a way? Because just look at the prevalence, 1 in 150 in 2004, and now in 2018, 1 in 59, and what I'm sorry is not captured here is in 2021 in 40. That is the prevalence from CDC Atlanta, 70 million people on the spectrum, 1% of the world's population, and current available treatments or rehabilitation or medical treatment only help in managing the symptoms, but the underlying brain condition is not helped. And hence the stem cell. What does stem cell do? So there are two theories for autism. One is hypoperfusion and immune dysfunction. So stem cell help to improve oxygenation and reduce inflammation, and thereby improve the neural connectivity. The first ever publication in the world to show like a proof of concept that stem cells work in autism came from Neurogen in 2013, closely followed by a paper from China in the same year, in fact, in the next month. So the first ever time we published in a journal known as Stem Cell International. We studied 32 children over a period of about 12 months, and with a similar treatment or combination of autologous bone marrow derived mononuclear cells along with intrathecal stem cell injection. And we found that there is an improvement in, first we started with objective scales. We found that there was significant improvement in the scales, as well as, so when we look at different domains of these scales, so Indian scale for autism assessment has different domains where you analyze the child's problem. So social relationship is affected, that showed significant improvement. Emotional responsiveness, speech, language, and communication, behaviors became better, cognition improved, and sensory aspects reduced. So children have three main issues for those who are not very aware of autism: socialization, communication, and repetitive rigid behavior. These are the three main issues, and we find improvement in all these areas. We find improvement in comprehension, understanding, and better response to therapy. As I said, we found improvement in 91% improvement in social relationship and understanding of sense information or sensitivity towards their surrounding, interest in their surrounding, better emotional response, more improvement in communication and speech, behavior patterns became better, cognition improved, hyperactivity reduced, attention and concentration improved, and eye contact improved. So the second publication from our institute came more recently and published in American Journal of Stem Cells in 2020, where we had a bigger cohort, 254 individuals or patients, and again we studied for an average of 7.5 months follow-up, and we looked at which areas improved to what, and again in all the different areas there was improvement in these children. We also looked at the scores, and we looked at different aspects in terms of severity. So we found mild, moderate, as well as severe autism children improved to almost 93%. That's possibility of improvement is 93%. Very interestingly, and we are aware that as soon to start the treatment early is always the best principle. So less than 5 years, there is a 97 to 98% possibility of the child improving. Between 5 to 10 years, it goes down to about 94%, and above 10 years, again to 90%. So as the age increases, the possibility of the child improving becomes lesser and lesser, and hence early intervention again is very important. Males and females improve equally well, and earlier as the child is diagnosed today and you bring the child within a year, almost 100% possibility of improvement. Between 1 to 5 years, 95%, and above 5 years after diagnosis, about 90%. So then we studied the brain imaging, and this is what we saw. I will show you a few examples. This is before the treatment, and we have to give at least a 6 months time period for the brain functioning to improve. Here you can see the blue areas, the cerebellum, the thalamus, and the mesial temporal, which is functioning less, and this is 6 months later. You can see the blue becoming green. It means the brain functioning or the metabolism is improving. This is another before the treatment, and 6 months later, you can see the dark blue areas are now becoming lesser or lighter blue. So basically brain activity is improving. Again here, this is an example of over a period of 3 years. So you can see the first treatment, before treatment in June of 2019, and then 6 months later, you could see this brain activity was less and much better. And then when the child came for a follow-up again after 3 years, we can see that the improvements is sustained. It has not gone down, and the child has improved much further. So this is a follow-up of about 3 years. People do ask us whether the improvements are sustained. So this does show us that yes, the improvements are sustained. Again, this. So there are a whole lot of, so these are all publications. Everything that we do is published, and we keep on evolving the treatments. This example. Now, this is a beautiful example of a child we treated in 2015. At that time, he was about 11 and a half years. Now he's 18 plus. This boy came from the US, and he was treated 3 times over a period of 3 years. Initially, when he came to us, though he was on the milder part of spectrum, he had fleeting eye contact and got the best rehabilitation in the US. His father is an Indian doctor, interventional cardiologist, and his mother is a nursing staff. So a very educated family with the best possible rehabilitation and therapy. This child had low eye contact was affected, low self-awareness, sensory issues like toe walking, oromotor sensitivity, stereotypical behavior, self-talking, aggressiveness, screaming, kicking, temper tantrums, outbursts and meltdowns, hyperactivity, poor command following, vocabulary low, fluency low. He was in a special school. After the treatment, within 5 to 6 months, you could see the changes, that eye contact improved, reading, temper tantrums reduced. He started exploring, because they have oromotor sensitivity, then chewing and different texture is very difficult. So started exploring new food, sensory issues reduced. He started brushing the teeth better. He had a lot of problem in wearing his own dresses, so he would always wear short sleeved or short pants. So his sensory issues reduced, and he was able to tolerate better clothing. Personal judgment improved. He could understand that he has made a mistake and he would try to rectify it. Cognition, memory, orientation improved. Attention span improved significantly. Command following improved. He could shop food for himself. Problem solving skills improved. He saved social play, started interacting with other children, better emotional expression, started riding a bicycle. So coordination improved, and became independent in his daily activities. He had the third, when he came to us, he was 11 and a half years old, but he had 3rd grade reading level. So 3rd grade would be maybe like a 7, 8 years old reading level. And within 5 months, he became a 7th grade reading level. So that's an amazing improvement in 5 months. This was the PET scan before the treatment. The blue areas became, much better after 6 months. So this was his report card, where he got A's in most of the subjects, and he got the GPA of 3.833. Isn't that amazing? An autistic child. And so he got a lot of clapping. So in 2015 he was mild autism. 2016 he was still in the mild autism, and in 2018 he was no autism. So this is Ganesh when he's recent, that he's a senior, he's passed out of his, graduated, and now going to a choir trip and doing summer jobs. So isn't that amazing? This journey, I would like to play a video of this child and listen from the mother's own mouths.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about neurogen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So he started not only speaking well English, but also learned Spanish. Isn't that amazing for a language shift? So I would just want to show you 2 more videos. One very severe autism from Kenya for 13 years. He was practically locked inside his home. No special school could take him. He was extremely violent, extremely difficult. He would roll on the ground, remove his clothes, run away from home. And this child, even at the age of 14, after treatment, is now calmer, better, goes to a special school, has started vocalizing. His speech is not normal, but started vocalizing, at least started doing his own work. Self-care is improved, an amazing improvement in coordination. He does swimming and cycling now. So he was untrainable before, but now more stage social and trainable. So this happened over a period of 2 to 3 years. So yes, it's a journey, but I think a journey worth considering and taking. So you can see a child who had no coordination and himself has improved. But there's this another child. I'm very proud of this child. He came to us when he was 4 years old. You can see extremely listless on this side, not even cooperating. He came a year later. He was better. He could sit better. He was practically non-verbal, maybe 1 or 2 words, and had no attention span. Now, after a year, we saw that he could, complete simple tasks. There was a development. He was much more focused. His learning was improved. So he had started improving, and a year later, we did another treatment. So first at 4 years, then second at 5 years, and the most amazing thing happened in the November of 2020. And I think that is a year none of us can forget. We were in the midst of COVID, and all of us, and whatever little way we could, and we were doing a lot of work in COVID and so depressed. And this is
once upon a time, Pete the cat was walking down the street, and his friend knew white shoes.
This is the same.
Pete loves his white shoes so much. He sang this song.
So
I love my white shoes. I love my white shoes.
Can you even imagine that? He can make a 3-minute video by himself. This is the story he has thought of.
Pete stepped in a large pile of strawberries. What color did it turn his shoes? Red. The Pete gray? Goodness, no. He can walk along and singing his song.
Impromptu impersonation and make a story.
I love my red shoes. I love my red shoes. I love my.
So what Zach's mother said makes a lot of sense, and this we are increasingly seeing that the stem cell treatment in his foundation years was really crucial. So the base, I said, the foundation, if it is good, if we are able to improve the brain functioning in the initial years, then making the building is much easier, and that's what we find. So that was about autism. So I'm going to cerebral palsy. I will try to be as brief. I know I am exceeding the time, but it's just it's difficult to put everything together in small time. I hope that it is all right to continue. A little bit of a cerebral palsy, we know what it is, and we know the treatment is medication for tightness and spasticity, anti-epileptic medication, surgery to reduce the spastic, Botox, or orthopedic surgery like tendon release, and sometimes very, very difficult procedures like rhizotomy, that cutting the nerve ending. So, but none of this really addressed the underlying brain problem, and that's where the stem cell procedure comes in. And this is so we have done a study of about 40 patients, and after that we have done another study which is still to be published. Just going to quickly share the results. For the 40, we had different cohorts: quadriplegic cerebral palsy, diplegic cerebral palsy, and others like ataxic. So what do we see generally? That we see here first improvement in the axial line, or the central. So it starts from comprehension, understanding, okay, and then oromotor, tongue movement, lip movement, chewing, swallowing, neck holding, okay, then the body, tone of the body, better sitting balance, then standing and walking in the hand muscles. So that's how the improvement is seen. This is a published study, and then more recently a study of about 262 children, again where we see that improvement to different degrees in various functions. Improvement in the scores, so GMFM and GMFCS, these are scores and functional improvement in the functional categories. So we do see significant improvement in these. Again, the brain functioning, very typically you can see the brain here before the treatment. A lot of, see, unlike in autism, here you see not only structural problem but also functional in the cortex. So you can see the frontoparietal region is affected, a little bit of the even the occipital region, and after the treatment in 6 months you can see improvement in metabolism here. So again, these are books and publications. So a case study, 7-year male from West Bengal. This child came to us twice. The first time when he came to us, he was GMFCS 4. So 5 is the most severe, 1 is mild. So he was more towards the severe. He was unable to sit without support. He was unable to stand. He was unable to walk. He had poor hand-eye coordination. He was unable to speak. He had poor command following. So cognition was also less. He was homeschooled. He didn't have any seizures, and he had grade 3 spasticity with deep tendon reflexes were brisk. So what are the improvements we saw over 6 months? Child was unable to sit without support, is now able to sit independently without support and make use of his hands. He was unable to stand without support earlier, then now he's able to stand without support and walk with a walker. He was unable to speak earlier. Now he started speaking in sentences. He was homeschooled due to physical limitations. Now this is the quality of life improvement. He started going to school. So this is our aim, to mainstream the children to be able to go to school, whether it's a special school or if possible to a regular school. So improved coordination, hand manipulation, improved balance, improved cognition and command following. So outcome measures or objective gross motor function measure, which was 41% improved to 58%. The GMFC's classification severity means higher number, 5 and 4 are more severe. The 4 became 3. The work balance improved from 4 to 11, and functional improvement measures improved from 44 to 59. This is a brain scan of the child. You can see here, parieto-temporal affectation along with the thalamus and the cerebellum. After the treatment, you can see improvement in the brain. This happened after 6 months, at least 6 months to see the changes. This is the same child. So this is difficulty in before we sit, just about some neck control. As you can see, he's able to sit much better. You just see the difference in the child, right? The faces has changed. He's able to stand. He's able to stand independently. Then he started training him to walk. He started walking with a walker. So child was barely able to sit independently, walk with a walker, is able to go to school. So this is the quality of life improvement in this child. This is another child we've treated, and over a period of 3 years, amazing result. He came from Bhubaneswar. He had ataxic cerebral palsy, difficulty in all activities, sitting, kneeling, standing, everything. So quite started improvement in cognition, improvement in identifying animals, speech became much better. So cognitive improvements we could see very initially. Then reach outs in hand, you can see earlier balance was an issue, kneeling was issue, sitting and doing hand activity because of the cerebellum involvement. You could see earlier he needed weight and support, and then now he's able to do kneeling, walking independently. Then he's able to sit from floor to go to higher level. Then he's able to walk, and this child now goes to school. So because of walking, earlier he would fall down. Now he's able to balance his body better. He's not 100% perfect, but he's getting there. So at least he is able to walk independently, even with difficulty, but he's able to walk, he's able to balance his body, he's able to use his hand functionally. He's now able to climb stairs, he goes to school, he sits with other children and he studies. So again, our 5-year aim is to get these children to be able to so earlier we started that this child came to us when he was 3 or 4 years, and over a period of 3-4 years, he came back to us for follow-up, and we were able to get him to this level of functionality. He is able to reach his classroom, his sits and his assigned place without any type of assistance. About a little bit about intellectual disability, again, brain functioning is affected. What do we have? Treatment, medication, behavioral therapy, psychological intervention. Currently, nothing to improve the brain functioning. So again, the first ever study in the world, an open label proof of concept that intrathecal autologous bone marrow derived mononuclear cell transplantation works at intellectual disability. First time ever in the world, published by Neurogen Brain Spine Institute. We studied 58 patients, and in fact, here this time we divided them into 2 parts: 29 who underwent only rehabilitation, 29 who underwent stem cell therapy with rehabilitation, to compare what is the outcome. And of course, so what you are seeing here is 2 different colors, right? So the blue is the intervention group and the orange is the rehabilitation only group. So let's look at the rehabilitation only. About 20% of the individuals did not show any improvement, while 80% did show improvement. Maximum showed mild improvement, very few showed significant improvement. So that's for the only rehabilitation. So yes, rehabilitation will give improvement. There is no doubt about that. But when we combine rehabilitation with an intervention like stem cell therapy, you see that most of the children, individuals have improved. None of them, there was nobody who showed no improvement. 10% showed mild improvement, 27% showed moderate, but maximum showed a significant improvement. So what are we doing here when we add intervention like stem cell to the rehabilitation is push the improvements towards the significant. So that's why the combination is very important. This is the qualitative difference in the type of improvement that you see after stem cell therapy. So improvement in cognition, in remote memory, in problem solving, understanding relations, social inhibitions improved, toilet training became better, command following, aggressiveness reduced, and attention and concentration improved. So you can see the brain here. You can see this is the brain before the treatment. You can see so much of problem. There's like a cortical atrophy before the treatment, and after the treatment, you can see much better cortical metabolism. You yourself can see the difference. I think it's very evident. So an example, though here I'm taking an adult intellectual disability, but what I want to show here is that if an adult can improve, then a child can improve so much better. So this is a 20-year-old male, came from Andhra Pradesh. He underwent stem cell therapy in 2019 and 2020. He was 20-year-old, but his social age was only 9 years old. His social quotient was 60. So you can see there was a 11 years difference in what his age was and what his actual social age was. So he had difficulty in reading, writing. He could not play outdoor games physically. He couldn't speak full sentences. Mathematical calculations were poor. Social behavior was affected. He could not interact with other individuals or children. He was not able to go out of the house independently. He could not buy groceries. He could not deal with money or calculations. So what are the improvements? The difficulty in reading and writing. Initially, he could complete schoolwork with minimal prompts, and he could go to the school classes by himself. He could do, earlier he was not able to do mathematical calculations, and now he can perform mathematical calculation up till 1000 independently. He was unable to buy groceries earlier, and now he can go to the grocery shop, and he goes to father's shop to help him. He had very poor social interaction, and now there's improved social interaction. He calls and he talks to his friends. He was unable to speak in sentences earlier, and now he can converse with customers and friends. He was unable to cook earlier, and now he can cook omelette and dosa by himself. So outcome measures, there was an improvement in the social quotient as well, from 98 months to 120 months. Social age improved, and all the other scores also improved from 8 years, 2 months to 10 years.
మరలా 2020లో ఒకసారి మరలా వచ్చాను, రెండో థెరపీ చేయించుకున్నాం. ఇంకా కొంచెం డెవలప్మెంట్ ఉంది. మళ్ళీ 2021లో కూడా వచ్చాం. 2021లో కూడా ఇంకా బాగుంటుందని ఆశించి చేసుకుంటాం. అంటే ఇదివరకు కాలిక్యులేషన్ కానీ చదవడం కానీ ఇంకా ఫ్రెండ్స్తో అది డిస్కషన్ కానీ సార్లతో కానీ మాట్లాడేవాడు కాదు ఇదివరకు. ఇప్పుడు ఒక ఫ్రీక్వెంట్గా వాడే ఎక్కువసేపు పడుతున్నాం మనం. వాడికే క్రియేటివిటీ ఎక్కువ పెరిగింది, తెలుసుకోవాలనేది. అందరితో బాగా ఉంటున్నాడు, కాలిక్యులేషన్ చేయగలుగుతున్నాడు, మాట్లాడగలుగుతున్నాడు. వాడిలో అసలు ఇదివరకు ఇన్ఫిరాక్ట్ ఉండేది, నాకు రాదు, నేను చేయలేను, నాకు రాదని ఉండేవాడు. ఇప్పుడు నేను చేయగలను, నాలో ఎబిలిటీ ఉంది, నేను ఎందుకు చేయలేను అనే కాన్ఫిడెంట్తో ఉంటున్నాడు. సెల్ఫ్ కాన్ఫిడెన్స్ వచ్చింది. చేయించేటప్పటికి కొంచెం డెవలప్ బాబులో కనబడ్డాయి కాబట్టి ట్రీట్మెంట్ చేయించాను. 3 సార్లు చేయించాను. తను ఇదివరకు ఎలా బతుకుతాడు, ఎలా ఉంటాడని భయం వేసేది. ఇప్పుడు నాకు ఆ భయం లేకుండా ఉంది. వాడంతటి వాడు కాళ్ళ మీద వాడు బతకగలడు, నేను లేకపోతే ఎలాగా అనుకునేవాడిని. ఇప్పుడు నాకు ఆ భయం లేకుండా ఉంది. వాడంతటి వాడు బతకగలడు.
ఫస్ట్ ఎప్పుడు జరగలేదు, ఇప్పుడు ఫ్రెండ్స్తో జరుగుతున్నాను. అప్పుడు నేను చిన్నప్పటి నుంచి అదే చదవలేదు. అప్పుడు ముందు డాడీ తీసేవాడు హాస్పిటల్కి, ఆయన మండలు ఇచ్చారు కానీ పెంచేది. తర్వాత డాడీ ఏమో బొమ్మలే అన్నారు, తీసేయలేడు. అప్పుడు ఫస్ట్ థెరపీ చేయించాడు.
So this is about intellectual. How safe? What are the complications? How safe is this treatment? Generally, we find autologous stem cells, there are no major complications or side effects. There are no neurological deteriorations. However, yes, in certain 10% of the patients, we do see a spinal headache after the treatment because of the lumbar puncture. It is transient and remains for 3 to 4 days or 2 to 3 days. Nausea, vomiting, pain at the local site. These are in few patients. Seizures is something which we have published. The possibility of seizures does exist in about 3 to 6% of the patients who have a history of seizure or whose EEG is abnormal. So there may be a transient episodes of seizures after the treatment, and this is what we published, in fact, because we believe in understanding and acknowledging the problems, and once we do that, then we can correct it. We can be cautious. We can do preemptive, take preemptive action to prevent this complication. So we found that when we look at the 2 parts, that seizures, those who had history of seizures, and what if we do a prophylactic regimen, then we can reduce it to almost 0%. So possibility of seizures is 3 to 6% of children earlier, and then with medications we were able to reduce the possibility. So this is something which we have published and which is available online freely. Now we added integrative therapies. Very in 2 to 3 minutes, I will just summarize this. Oxygen therapy. So oxygen therapy or hyperbaric therapy basically means giving oxygen at increasing pressure so that our body gets flushed with oxygen. So normally if you look at the oxygenation is through the red blood cells, and the oxygen is carried only by the RBCs. But in increasing pressure, when oxygen is delivered into our body, it diffuses into the plasma as well, increasing the oxygen carrying capacity. Now this increases again it stimulates the stem cells in our body. It improves immunity. Hyperbaric oxygen helps to heal the body. Hyperbaric oxygen is now being increasingly used as an anti-aging method. We now see that cellular changes can happen because of HPOT, and there is a lot of study. And in children, it is at least 10 sessions to 40 sessions done over a period of time, and then combined with stem cell, we find has improved our effectiveness of the treatment. So there are a lot of studies about how HPOT helps. It reduces senescence by increasing the telomere length of the cell. So basically anti-apoptotic effect. And even muscle injuries are being treated by HPOT. So these are just to show that there are a lot of publications. Some give very good information about how HPOT works. Also for in bone marrow transplantation, post-transplant bone marrow transplantation, better engraftment is seen with after if we do HBOT after bone marrow transplantation. So stem cells seem to flourish under HBOT treatment. Cell proliferation, angiogenesis, wound healing also improves. So that is HBOT, and we are doing it for autism, CP, Down syndrome, all neurological conditions. I don't think I want to show that how HBOT is done for lack of time. That is available on the net. And ozone, again, the concept of ozone came to us during COVID, and I'm completely transformed as like a ozone supporter. So ozone is basically O2 converted to O3, and this is medical ozone, not environmental ozone. So this works as an antioxidant, anti-inflammatory. It improves your immunity, acts as a blood thinner, thereby improving the blood supply. So it again, along with HBOT and with stem cell, works complementary and rehabilitation. So that is again addition that we have done, just to show you that we do ozone and what are the studies on ozone. Of course, there are some applications, and deep tissue mobilization, or we know as acupressure, improves oxygenation. Okay, so this is about the combination treatments. Now, I'm not sure, can the host please tell me whether I have time to talk on the controversy and the ethics and regulations, because that's again a different chapter altogether. So
I think Nandini, we can very briefly, I think next couple of minutes you could touch on that.
Okay.
And then we'll take the question answers.
Yeah, because I am expecting questions on that. So very briefly, because it's again itself is a very huge topic. So the controversy started with George Bush when he banned federal funding for new embryonic stem cell research, and in 2001, and this was reversed by Obama in 2009. This was on embryonic stem cell, but what people know only is that stem cell is banned. So we have to make the distinction. What is the type of stem cell and what exactly? It wasn't banned. Federal funding for embryonic stem cell research was stopped, and it was not based on scientific ground. It was based on religious ground. Because embryos, as I said, life starts at conception is one of the religious thoughts in Catholics, and that's why the following the Roman Pope, George Bush stopped federal funding for newer embryonic stem cell research. But that was again lifted by President Obama. So from there is where all the controversy or the thought started. So what is the present, position in different parts of the country, in different parts of the world on stem cell research and therapy? So when President George Bush stopped federal funding for embryonic stem cell research, the rest of the world, and more in our part of the world, in the Southeast Asian countries, started looking at other non-controversial sources of stem cells, and that's where adult stem cell got a lot of precedence, because we are not using embryo, or cord blood or adipose tissue cells, or even dental pulses, bone marrow. They got a lot of precedence. Now, of course, we all follow the ICMR, but so ICMR in 2007 actually gave, if you look at one of the earliest guidelines, so ICMR is guidelines, it is not regulation. In 2007, guideline for stem cell research and therapy. Please note this, in 2007. Then 2013, the change is to guideline on stem cell research. So we went into a regressive phase from 2007 to 2013. Having included stem cell research and therapy, went into stem cell research. So these are guidelines, only guidelines, no laws. And the Gazette, now the DCGI or CDSCO, is now working on the stem cell Gazette and stem cell regulation, where they are differentiating what is a drug. Okay, whether stem cell comes in drugs. So when there are different types of stem cells, they're looking at distinguishes what are autologous cells, minimally manipulated, that they do not come into drug, while the multiplied cells, allogenic from outside, they would then come under the drug. So that distinction is now being made. The stem cell derived product versus a procedure done by a physician. So that So what is stem cell? Stem cell based product is a drug which has been derived from processed cells and which has undergone manipulation and multiplication and differentiation. So that is something, so that's a distinction now being made because the yardstick. So there is a distinction between Coke and alcohol versus a homemade orange juice. That's a distinction that is being made. So that's a distinction between a product and procedure, and a lot of support from the Prime Minister, from the Health Minister, from the DCGI, from the Indian Medical Association and the Stem Cell Society of India. So ex-president, so there's a lot of history. I'm just going ahead. So you can just see that there is a lot of support from the Prime Minister, our ex-Health Minister, as well as the previous DCGI. They have also given a lot of support to stem cell therapy. So a lot of work in progress, of course, and of course, who resist or who are opposed is the ICMR and medical forums, and we are upfront about it. We do know that, and in other countries, Japan has a very good. They're looking at implementing this much faster, fast tracking. So initially giving conditional approval and then converting into actual treatment. So that is something which is happening in Japan and in Korea. So a lot of positive work in other countries, and even in the US now. In fact, if you look at, there are different laws. I'm sorry. So there's a lot of history. I'm just going ahead.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
This is something that few people know. People just remember the controversy and don't remember this very, very important.
There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
This certainly is our message, our hope, and unfortunately, this amazing individual was not able to receive this hope and positivity. All of us know about Christopher Reeve. He had a spinal cord injury, and Christopher Reeve Foundation doing a lot of work on finding a way to regenerate the spine. So, taking ahead from there, that I would go anywhere in the world for therapy that is safe and could accomplish the goal of recovery. And that's our purpose. That's our vision. And the last 14 years, this is what we have been trying to do. Thank you so much for patient hearing. And I hope I was able to shed some light, some like a brain teaser for you to go and read more about this concept, stem cells and regenerative medicine. Thank you so much. I'd be happy to take questions now.
Thank you so much, Dr. Nandini. In fact, that was passionate as always. Since we last heard you many years back in India Habitat Center in New Delhi with a team of my DM students who've since then graduated out of the institute, I thought that this would be a perfect opportunity for the communities of practice and the larger audience. And mind you, we have quite a few moms also in this group of our patients who have neurodevelopmental disorders as NICU survivors. And they have been in touch with all of us right through. I see a ray of hope for most of the patients who are as parts of this communities of practice. Like I just mentioned, it's not a communities of practice which is exclusively for doctors and nurses, but also actively involves a lot of mothers and caregivers in its sessions, which are meant for the community betterment at large. Your work, especially at Neurogen, has led to path-breaking improvements in the quality of care, as well as the patient safety and the neuro-rehabilitative aspects of patients with neurodevelopmental disorders. And it goes without saying that such works need to be extensively supported by most of the medical fraternity, especially the neonatal fraternity, the obstetrics fraternity, and the quality of care fraternity across Southeast Asia. We compliment you and your team at Neurogen for carrying out such path-breaking research, publishing, and also showing the evidence along with real-time videos and objective evidence in terms of improvement in the brain activity as evidenced by the PET scans. So I think we've have a lot of questions, and there's some participants who are raising their hands. So first, I will very quickly take the questions. We'll restrict the question and answer session to next 10 minutes. It was already 8 o'clock, already 90 minutes into the session. So I will start with the question from Geeta Rani. She asked that is anyone who's healthy can donate or preserve his own stem cells? That is the first question for you, Dr. Nandini.
You can, a healthy person can donate a stem cell, but the indications would be more for hematopoietic disorder. I would encourage everybody to, yes, register in the bone marrow registry, which would be very helpful for conditions such as sickle cell anemia and leukemia, and especially for children disorders. So yes, for those conditions. For neurological conditions, we believe that safety is very, very important, and hence storing of use of allogenic cells at this point we are not very convinced is a good idea. Cord blood cells can be stored if there is a history of certain disorders in the family, so that can be stored. Yes, there are a lot of other sources now which are being studied. I will not say that they are really currently have a lot of scope, but they are being studied and even being stored, and that is adipose tissues or dental pulp cells. So worth looking at them for future use. So so that would be the answer. I hope that is all right. Yeah.
Thank you so much, Dr. Nandini. Next, we have a question from Dr. Aritra Ray. He just completed his DM and is on his way back home today. So thank you so much, Aritra, for putting that question. He wants to ask from you, what's your opinion on amniotic stem cell therapy for BPD, that is bronchopulmonary dysplasia? For babies who are born extremely preterm and who are on ventilators suffer a lot of barotrauma, volutrauma, etc. And they have these remodeling of the alveolar tissues, to put it simply.
So though there is not a lot of, I'm not sure there's a lot of work on that, but from our work in COVID, I can just extrapolate. We have used mesenchymal cord blood stem cells for COVID, and when given intravenously, in fact, these cells do go to the lungs and improve the lung functioning. So if lung functioning needs to be improved, I would say that yes, for pulmonary dysplasias, it is worth looking at intravenous, and it would be safe. So intravenous mesenchymal stem cells from cord blood would be a good option. Amniotic stem cell, I'm not really sure we'll get enough cells from the amniotic fluid to give. So the number has to be good enough. So yes, intravenous, that is something worth looking at in terms of we can do a trial, I think, for such patients, could be life-saving, yes.
Okay, great. I think that answers Aritra's question. So there's a question from Dr. Reggie Kumar R. He wants to know, he has complimented you on a great learning session. And he wants to know that what are your insights on higher educational prospects in this field?
Yes, see, the field of in regenerative medicine, there are certain courses which are now being given out by certain universities. I think D.Y. Patil in Mumbai and Manipal University has a course. If you look at my evolution, it was more jump into this water and do it. We would encourage clinicians to come in. It would be great if their minds open up. We would be happy if they want to work it. It would be more like a fellowship. There is no structured program, but whoever is interested in coming into this field, we believe a little bit of research would be good to have. I did my MD in medical microbiology, and then I did about 4 years of postdoctoral fellowship where we looked at the cells. You need to be convinced that what you are dealing with is something which works. Okay, so unless you see it, you don't believe it. And then a combination of clinical with research would be a great thing to have. So if pediatricians would like to come into this field, do a small, maybe a year fellowship or so in the laboratory, and that will give you a lot of insight and convince you that this is a field, or these cells do work, and then we can get into the field of the treatment purpose, come back into treatment. So it's an amazing field. It is not without its struggles, because the mainstream medical community is still to accept this. But yes, it would be great if young minds want to come into this field. It is, I feel, about 10 years back, we wrote a book where in the preface we did write that we believe that in the future, regenerative medicine will replace organ transplantation. In fact, one of my colleagues, my batchmates, who are liver transplant surgeon, a very renowned liver transplant surgeon, he keeps telling me that I'm going to do as many liver transplants as possible in the next few years, because I know that stem cell is going to take over the field and we may not need to do liver transplant. So it's an exciting field. Please do consider taking it up as an option. Yes.
So we have, thank you so much for answering that. We have a question from Amol Joshi. Amol is the Associate Professor of Neonatology, a very promising neonatologist at Aurangabad. Amol, please go ahead quickly.
Madam, thank you for the presentation. I was very intrigued at the idea of babies with cerebral palsy getting benefited by just autologous stem cell transplantation. What is the earliest stage in your experience you have given autologous stem cells and the baby has improved?
See, the earliest stage would be about, we are limited by the weight. We would like the child to have at least 9 kg weight, 9 to 10 kgs, because we are going to sedate the child. So the child should be able to take that sedation. Plus, we need the bone marrow. So the amount of bone marrow that we take out also is depending on the weight of the child. So we would prefer to have a 9 to 10 kg weight if possible. Or if the child is healthy, we have done an 8 kg child also. So the earliest child we have done maybe like 8 months, 9 months old. I would say a year is a good time. When we start at a year, then we do see beautiful improvement, because the brain is still developing and the child doesn't have so many complications like deformities and all. So about a year would be a good age to start with. We would request pediatricians and neonatologists to please take care of the complications. If it's, I would like to use this forum to really appeal to all of you to do prescribe PEG feed for these children, because they have a lot of complications because of swallowing issues, and that hinders their overall growth. So they have a lot of failure to thrive. So if we can get them in a good medical condition, we can treat as early as 8 months also. So the limitation is again the weight. So 8 to 10 kgs with not many respiratory issues would be a good age to start. Is that was there a follow-up question?
Yes, ma'am. Yes. And I don't know whether this is correct and on this forum, what would be the approximate cost of therapy for such child at 8 to 10 kg?
See, the cost in different places, it varies. We have a combination treatment. We have like a week's hospitalization minimum and goes up to 2 weeks if you add on the oxygen therapy to it. So it would be a minimum of 2.5 lakhs, and it can go up to 5 plus. So but for those who are unaffording, I would also like to say we have a social work department who helps treat these children at very low cost. We do a lot of crowdfunding for these children. We treat those who are below poverty line at very low cost as well. So because of funding issue, treatment will not happen is usually not the case. It will take a few days to get that funding, but I would say 2.5 to 4 lakhs is the ballpark figure. But we are also trying to get it into Ayushman Bharat. So in the next year, it should be
okay. Thank you, ma'am. Thank you so much.
Thank you so much, Amol. So I would just like to mention here to the larger group which has been witness to this phenomenal presentation from you today, that we should spread the word. And with your permission, it will go up on the Communities of Practice platform and the YouTube channel of NQCN. And the people who missed it will be directly accessing it through the link. And Dr. Nandini, we look forward to hearing you again. And over to Dr. Praveen Venkatgiri, Secretary NQCN, for the concluding remarks and a vote of thanks to Dr. Nandini and all the participants, including the parents and the caregivers who've all assembled in this session, which is very unique and very special for all of us, and even very emotional, seeing the improvements of the children with this marvelous therapy. In fact, it brought tears to our eyes at multiple moments when we saw these babies improve. Over to you, Praveen.
Thank you so much, Vikram sir. Thank you so much for just being so open-minded. That is most important for I mean, I cannot tell you how honored I am that you invited me for this, and would be happy to do talks, and we are open to, happy to do any time. And if there's a physical audience, if you ever do a physical talk, please do invite me. I would be happy to come.
So I think with that, we come to the end of today's session. It's been wonderful hearing you and the lovely interaction. Thank you so much. And we look forward to another exciting session. And I would just like to remind the audience that we are holding a physical conference, the International Conference on Healthcare Quality and Patient Safety, which will be held on 12th and 13th November, which happens to be a Saturday and Sunday at Pravara Institute of Medical Sciences in rural Maharashtra, which is very close to Shirdi, just 10 minutes from there. And we are having the workshop sessions on 12th and 13th. We are going to have multiple sessions, 5 concurrent halls, which would be running span, especially one hall which is entirely dedicated to primary healthcare workers, and this would be run in Marathi and Hindi. So I request all of you to visit our website. Dr. Komal will put the link of registering for these workshops, and we also have award papers, poster sessions, and multiple plenary sessions, and very eminent international speakers who are going to be interacting for patient safety and quality issues. So please make sure that you are a part of this conference. And Dr. Nandini, if you have time, I take this opportunity to invite you online for the conference. Thank you so much. Thank you so much. And good night. Over to you, Dr. Komal, for the feedback. Thank you so much.